Hi, everybody. I'm Deborah Z. Roth, the new Director of Communication Strategy for the Amputee Coalition. Welcome to today's webinar. Today's webinar is being recorded and will be made available after on the Amputee Coalition's website. Today we're here to talk about advocacy, and we're going to cover some of the Amputee Coalition's advocacy priorities and how you can get involved with the Amputee Coalition's advocacy efforts. Good morning. My name is Joanne Zurcher, and I'm the Senior Director of Government Relations at the Amputee Coalition.
And my name is Dan Ignaszewski, and I'm the Amputee Coalition's Chief Policy and Programs Officer.
We are hosting this webinar, Intro to Advocacy, to help those of you who are interested in advocacy efforts, who want to get more involved with the Amputee Coalition, and who want to make a difference in your community. So whether you're new to advocacy or have significant experience, this is a chance to learn what you can do to be an advocate with the Amputee Coalition. So let's get this webinar started.
We'd like to recognize that this presentation and the National Limb Loss Resource Center is supported in part with a cooperative agreement from the Administration for Community Living, and that's helping us bring the webinar to you today. But I want to also highlight the Amputee Coalition's mission. And the Amputee Coalition's mission is to reach out to and empower people affected by limb loss to achieve their full potential through education, support, and advocacy, and to promote limb loss prevention. The Coalition's new 5-year strategic plan, which launched this year, is focused on elevating advocacy efforts because we recognize the effect that advocacy efforts can have on the community as a whole.
The Coalition has done a great job with education and support, but so much more can be done on our advocacy front. We have amazing folks we have trained to be effective advocates, and we are poised with the organization's new leadership and direction to really focus on advocacy efforts. 3 months ago, I was hired to take our advocacy to the next level. We are in the process of hiring a government relations manager and later this summer, a grassroots coordinator to fill out our government relations team. So let's dig in and talk about advocacy. Advocacy is the art of standing up for yourself and your community to make a positive difference in your circumstance and environment. If you're able to educate elected officials, advocate on issues that affect you and your community, and act on supporting policy initiatives, you can be an effective advocate. Everyone has advocates in their lives that they may or may not be aware of. These advocates can include your family or friends, your religious group, your job, elected officials, and even patient advocacy groups like the Amputee Coalition.
In addition to people advocating for you, it's important to think of advocacy as approachable. Whether you realize it or not, you've probably already been an advocate for yourself in a variety of everyday examples. One of the common examples that we use often might be advocating for your healthcare providers and making sure that you get access to the care that you need. You may also have experienced a situation where you've signed up for a promotional discount on something like the cable or your cell phone bill, only to find that after the promotion ends, you find your rate increase, and oftentimes substantially. What do you do in that situation? You can either accept the increased costs and keep going month to month paying more, or you might do what a lot of other people do, and you might call your provider and advocate for a reduced rate or a better package. These are some simple everyday examples of advocacy.
But today, we're going to focus on policy and legislative advocacy. When it comes to this type of advocacy, it's important to know that you are your own best advocate because it's your story that legislators want to hear. If you take time out of your busy day to tell them your story, that puts a face on the issue and makes it real. So when policymakers are thinking about what they should support or how they should engage on policy issues, it's your story they remember.
We advocate on both the federal and state level for better access to care, research programs, and awareness. On the federal level, especially, we'll be focusing on legislation that ensures that all those living with limb loss and limb difference have access to prosthetic care they need, improving coverage through Medicare and Medicaid, and lead and support collaboration initiatives like Cures 2.0. While patient involvement in care access, affordability, and delivery provide better integration of families and caregivers in patient care, and look at a system of benefit and reform in Cures 2.0, we can really move it forward. Health reform isn't going away, and the coalition recognizes the need to ensure people with limb loss and limb difference have a voice in protecting community needs in any healthcare reform legislation, such as pre-existing conditions protections, no caps on insurance coverage, and keeping prosthetic care as part of essential health benefits.
Another area that we focus on is funding for research and programs that's important to the community. Given the 2 million Americans living with limb loss, the community hasn't received the same proportional support in program and research funding as some just as important but numerically smaller patient populations. We've been successful as an organization and as a community in increasing support for programs and research over the past few years that impact people with limb loss and limb difference. And we regularly work with legislators and agencies to elevate the existing work that's happening and to identify new opportunities to expand the support for these initiatives.
Awareness is also important. April has been designated as Limb Loss and Limb Difference Awareness Month, and is a great opportunity to raise awareness about the community and the issues affecting community members. One of the key ways we do this is working with advocates to request recognition from all 50 states through proclamations signed by governors recognizing limb loss and limb difference awareness. Those are 3 big buckets that cover these and a number of other items. So, phew, that covers a lot of work and really shows why we need your help. I cannot emphasize it enough how much your telling your story can change the world. I have been doing advocacy in some form for over 25 years and never have had a political action committee or any other funding to financially support candidates. What I had is amazing advocates who were willing to raise their voices for something they cared about. Then with good follow-up, shaken with some guilt, fear, and shame, baked with some luck, things can change. I even promise to make these events as much fun as possible for you. So come to our advocacy forum, where we'll train you on a very deep level to be amazing advocates this April. You can register today to come for free and get trained and meet with your federal legislators. You can also come to our national conference in August, when we'll have additional training and multiple advocacy sessions. Throughout the year, we'll be sending out our advocacy alerts for you to call or email your representatives and senators, and responding to those is essential to showing members of Congress what issues are important to their constituents, especially this year, an election year.
And let us know you care. Let us know that you're interested. You can also sign up for our mailing list on the Amputee Coalition's website to get updates and receive calls to action. If you follow us on Facebook, Twitter, or other social media, you can also get updates and engage with other advocates and sign up to become an advocate on our website at amplifyyourself.org. All of those are resources available to you to be able to engage and help elevate what we're doing and elevate what you can do with the Amputee Coalition. When you sign up to become an advocate on amplifyyourself.org, you'll be sure to receive the first communications about ongoing advocacy efforts, and you'll have the first opportunities to engage with our advocacy trainings and some of our other events.
Because we cannot do this alone, your support and engagement is vital for our overall success. So now, we think you want to be an advocate, but how do you do it? Think about your story and how does it connect to the issue? What are the most critical elements? Keep it simple. Then check with the Amputee Coalition's website for data points to add. For example, we know there are 2 million Americans living with limb loss and limb difference. Or the data that shows 5-year costs of providing prosthetic care can actually reduce overall costs. Help us dispel myths about the community and let legislators know about the leading causes of limb loss: vascular disease, diabetes, and trauma. Engage with other members of your community, including support groups. What are they saying? What are they working on? How can you get them involved? Get to know your local leaders in both business and government. Are they aware of your local concerns? Are they able to help? Get trained by the Amputee Coalition to be ready to visit your elected officials. Use our templates we will send out in email blasts to write letters or make calls.
And that's a really good point, because just this week, we actually saw instances where getting to know both your local government and elected officials, as well as some of your local business leaders, can really have a significant impact. We have a couple of lead advocates that have taken on efforts in the state of Kansas to try to improve access to care in that state. And they've specifically been looking to pass the Insurance Fairness for Amputees law. And while we don't anticipate that bill to pass this year in Kansas, the advocates were able to get something that was a real tangible benefit and real tangible outcome because of their advocacy networking and promotion of the issues. We just received word either yesterday or the day before that Blue Cross Blue Shield of Kansas, who was previously not covering microprocessor or myoelectric devices in their insurance plan, because of the legislation and because of the advocacy efforts by some of our lead advocates, they've actually decided, and they've written a letter to acknowledge that as of January 2021, they will start to cover those devices in their plans moving forward. So advocacy is really important, and we can't overemphasize enough the importance of networking within your local community. There are a number of other ways that you can get involved as well. The Amputee Coalition makes it as easy as we can. We provide the template letters and the call scripts, and we provide talking points. We also provide fact sheets and leave behind resources that can be provided to elected officials. We provide the expertise on staff that's needed to help make a compelling and bipartisan case on all of our policy priorities. But like Joanne mentioned, it's your story that we can't replicate or convey. Sharing individual experiences and how they connect to the issues is where your experience is necessary. The template letters and call scripts even have places where you can specifically include your story and how it connects to the issues. Working in collaboration with the Amputee Coalition is absolutely vital because it allows us to all share a common voice and message, which allows us to then elevate your individual stories and really paint a bigger picture of why change is needed.
Federal officials want and need to hear your voice. They want to know what you care about, but can be very apprehensive about how to deliver what you're asking them to do. This is where providing solutions is key. Finding common ground to bond over can be helpful in gaining their trust and connecting issues to them. Look for connections between you and your representatives. Research their backgrounds. Did they go to the same school as you? Did they attend the same religious groups you did? Did your family members get their hair done at the same salon? Making connections helps. The Amputee Coalition can help make those connections for you to attend to. And if you attend the Advocacy Forum in April, we can show you what it looks like. Some of my favorite quotes are up on the screen right now. If you aren't at the table, you're on the menu. It really means a lot in a very short sentence about being an advocate. When you're at the table, you can have a conversation about what the policy is. When you're on the menu, you're getting cut. And then all politics is local. I think we've made that quite clear about working with our local politicians and business leaders. But advocacy efforts can change the world. Remember that the most important political assets are your voice, your vote, and your ability to write. Let's use them together.
Thank you for your commitment, everyone, to attending today's webinar. That concludes the presentation portion, but now we'll take a few questions.
And it looks like we've got a few good ones in already. The first one I see here is related to trying to figure out how we can connect different experiences and different stories. So the question was, you know, with all the different causes of limb loss, how can we connect to balance each other's stories and elevate some of the advocacy that we're doing? Some of the ways we covered in the webinar today, the National Conference and the Advocacy Forum are great opportunities. In addition to that, connecting to some local support groups or other volunteers are other great opportunities for that.
And I would just add, connecting the dots to bigger issues. It may be that you have a different type of limb loss or limb difference, but what we can all come together on is making sure there's access to care, and then elevating that story about how you need better access to care. And that goes across all of limb loss and limb difference.
Yeah, absolutely. Another great question is, my son is 15, and as his mom and a pediatric nurse, I recognize the importance of advocacy. So I know it's important for my son to be able to be an advocate for himself as he grows and becomes independent. The question is he old enough to attend the advocacy forum?
Absolutely. I also have a 15-year-old, so I understand completely that it's great to get them engaged at this point in time. I truly believe the earlier the better. And if he can, anybody who can speak in complete sentences is absolutely welcome.
Absolutely. We've even had, I think the youngest advocacy forum attendee I think we've ever had was actually 4 years old. And so we absolutely welcome anybody and everybody to be able to participate in the advocacy forum. Another question was, I want to get involved. Is there a list of local individuals that I can connect with to be able to help facilitate that? We can't provide lists of people. It's something that we're very protective of everybody's individual privacy. But what we can provide is local resources with respect to support groups and things like that. And if you're in a state that has a lead advocate, or if you're interested in becoming a lead advocate, there's a little bit more networking that can happen within some of those states at that level. So if you're interested in participating in some of our trainings, the advocacy forum is sort of the next big opportunity that way. And we'll be able to train you to be an effective advocate and help connect you to some of the folks that have become volunteer lead advocates with the organization already. It looks, the next question is, when is the federal budget process over, and what's the window to advocate for federal budget priorities?
Great question. So the president's budget came out in the beginning of the month. The National Limb Loss Resource Center has received $4 million in his budget. We're very excited to be included in his budget for the first time. So now the members of the appropriations committees will be meeting to discuss the budget, where they're going to come out on their numbers for the appropriations from Congress, and they'll meet somewhere in the middle. Hopefully we'll be able to hold on to that $4 million for the National Limb Loss Resource Center. We'll be working very hard on that. It probably will be open throughout most of the summer because it is an election year, and while we would like to think that it's going to go fast-paced, we have our fingers crossed, but a lot can happen between now and then. We'll keep you informed and let you know as the legislation speeds up when to call your members and advocate for the $4 million in the National Limb Loss Resource Center.
Perfect. The next question I have here is, can you elaborate on what will be covered during the advocacy forum, the cost, and/or where more details can be found? So the first and foremost, there's no cost to attend the advocacy forum in terms of registration fees or anything like that. Registration is free. You can register on our website. We do need everybody that wants to attend the advocacy forum to register. The reason for that is because we actually set up meetings with your member offices in the House and Senate to be able to help you go up and meet with your federally elected officials to talk about some of these issues and go through them in more detail. So we do need everybody to register, but there's no cost to register. There are additional details on the Amputee Coalition's website. If you go to the main page under the What We Do, under Advocacy, there's a title called Advocacy Forum, and you're able to go there and find out more information about the recommended hotel for those of you who may be coming from out of town. There's a discounted opportunity there for that. And then we also, in terms of logistics, we're going to be doing a webinar probably either later this month or more than likely probably in early March to help people prepare for the event. What we'll actually be covering there is very, very in-depth details of what we're asking for with some of these legislative priorities, how we're asking for them, what the impacts are going to be, and really digging into what the asks are going to be for members of Congress. For everything from, we need you to introduce this legislation, we need you to sign on to sponsor this legislation or move it forward, we need you to support funding initiatives. All of those are going to be the types of requests that we talk through. And what we're going to be training you on and train people on is to make sure that you feel comfortable being able to share your story, connect it to the issues, and be knowledgeable and ready to be able to talk about some of those issues with your elected officials. I've got a couple questions about being able to connect with the Amputee Coalition. If you reach out to us, you've got Joanne's and my contact information on the screen here. Please be sure to reach out and let us know if you're interested in getting more involved, whether it's in advocacy or getting involved in the Certified Peer Visitor Program, and we can connect you to the appropriate staff members. Another question was, what resources do you employ to enforce the rights of amputees under the ADA and similar state laws? We don't have a lawyer per se on staff, on retainer, to be able to protect those things, but we do work with people in their communities to be able to help support issues that are being faced that are ADA related issues. And so we are very, very interested in working and identifying those types of things. If there are ADA challenges or issues that you're experiencing in your community, we do ask that you reach out to us and contact us and let us know, and we can help navigate and inform you about what the options might be and how to best navigate a strategy to try to change those issues. Just trying to see here, going through a couple of other questions. We had a lot of questions. Thanks everybody for those. Do you have any suggestions on reaching out to other organizations or people in local communities? So I think for some of those questions, those are a bit broader than some of our advocacy initiatives. For those of you that might be interested in connecting to community resources or community events or other organizations, I mentioned before the Administration for Community Living helps support the National Limb Loss Resource Center. And the National Limb Loss Resource Center can be contacted at 888-267-5669, or you can email them at info@amputee-coalition.org. And lastly, we have a form on our website. If you go to the amputeecoalition.org and you go to our website, there's an Ask an Information Specialist. Those are our staff that are trained and equipped to be able to provide you the connections to your local community, the resources, the organizations, and things like that that might be available. I've got time for one or two more questions here. Let's see what we've got. Here's a good one, Joanne. Should our contact with our local or federal legislators be one and done, or should we develop a long-term rapport with them and their staff?
Great question. Please do everything you can to develop a long-term relationship with them, because while this year there might be not a lot of legislative vehicles to get things done, developing and educating your legislators, both the state and federal level, is a key to making a difference, because the more they trust you, the more they'll reach out to you as the expert on these issues. And when there's opportunity to pass something or to get funding, they will look to you and your leadership.
And then, let's see here. It looks like a few of these are related to the Certified Peer Visitor Program. So for those of you who might be interested in doing the Certified Peer Visitor Program, we can certainly have some of our appropriate staff reach out to you on the Certified Peer Visitor Program. That's a great opportunity to give back to the community, support the community in a little bit different way, but it's still related to advocacy. It's advocating for how you can get involved and support others in the community in their recovery and readjustment. And so for those of you who are interested, we can certainly connect you with those. Again, if you also want to reach out to the Limb Loss Resource Center, you are certainly welcome to do that as well, and they can connect you with the appropriate resources in that space. I think that covers most of the questions, and we're running right up to the end of the webinar here, so I think we're going to go ahead and close out with that. I do want to reiterate Deborah's thank you for everybody for attending. I also want to note that I've got a number of people that have already applied to become advocates, so for those of you that have done that, I thank you very much. Again, if you are interested in signing up to become a lead advocate or get involved in more detailed trainings or efforts with our advocacy program, you can email Joanne or myself. You can also fill out the form on amplifyyourself.org to get involved and become an advocate. So with that, I'd like to thank everybody and give everybody back the rest of their afternoon.
Thank you.
Thank you.